Hi, good afternoon, and welcome to the July edition of the Wednesday webinar series. I'm really excited about this month's webinars because we have two webinars happening in the same 1 hour slot instead of one. I'm also excited because this time around we have reached out to our alumni community as well, and I see that some of the alumni are sort of logging in to watch the webinars live. So thank you for joining us. And the way this is going to work is we're going to have two webinars from 1 to 2 p.m. Eastern Standard Time. And in the first 30 minutes, we will have Trish present her topic. And then in this next 30 minutes, we will have Arturo talk about differentiating communities from societies. And so it's a bit of a time crunch, and it's the first time we're doing this. And both these webinars are compulsory for all active fellows. So you are required to fill out the evaluation forms, but also I would encourage the alumni to fill out the evaluation forms that I've mailed out to you so that the speakers get a sense of how well they spoke and also of the platform that we're using. Just a quick sort of instruction on the Q&A piece. If you look at the event page, there will be a Q&A button at the bottom. If you click on that, you will be able to post questions, and the speaker will be able to respond to them as you go along. Since we have 30 minutes, there will be 15 to 20 minutes of conversation, and then we'll move on to the question and answers piece. And feel free to reach out to Trish or Arturo afterwards in case you feel that your questions were not answered. So I'm just going to quickly introduce Trish, who's our first speaker, and then sort of hand it over to her. Trish Sewe is an Atlas Corps Fellow from Kenya, and she's serving at Global Press Institute in San Francisco as a communications coordinator. And she has a range of experience in social protection. Prior to joining Global Press Institute, Trish worked as the Programs and Communication Officer for the Social Protection Actors Forum, which is a coalition of non-state actors committed to support social protection in Kenya through the promotion of citizens' engagement in the development, implementation, and evaluation of social protection interventions. She has 10 years of experience in the nonprofit sector and is well versed in public relations, community relations, as well as print, electronic, and social media. I'm really excited about the talk, and and over to you, Trish.
Oh, thank you very much, Jonas. Hello, everyone. I am happy to be here with you guys, and I hope you're able to see a presentation which I'm going to be doing. So with that well done introduction from Eunice, I'm here to engage you in a discussion about social protection and why you should care. So probably some of you have not heard about social protection before. So this presentation will basically be outlining what is social protection, the approaches that are to social protection, the multidimensional impacts, and things like that. So first of all, I want to apologize for the background noise. As you probably might not be able to hear me clearly, the room that we had booked for this particular presentation was taken off at the last minute. So I'm currently doing the presentation out somewhere near the cafeteria. So the first thing that I want to talk about is that when you talk about social protection, the first thing that comes to mind is poverty. And social protection is about dealing with poverty. Currently, we have facts that come from World Bank, and we have facts that come from the UNDP, ILO, and most of these big donor agencies that are dealing with social protection. And it is really startling to find that over 1.2 billion men, women, and children are currently living in a situation of extreme poverty. And the International Labour Organization also puts the whole population that in the whole world, we have 20% of the world's population having inadequate social security, and more than half of them lack coverage at all. So what is social protection? Imagine yourself going about your own life, doing things every day, and then all of a sudden, something beyond your reach happens. So you're flying, doing life, and then all of a sudden you have to deal with things that make you fall down. This kind of scenario happens a lot of times to many of us, especially Sometimes you may lose your source of livelihood due to reasons that you cannot be able to control. Falling ill, having an accident, a death of a breadwinner, and all, or even growing old. All these things, we all need a safety net, and that is where social protection comes in terms of insurance or coverage or something that is going to help you deal with life. And that's what this picture, as you see on the screen, is all about. I'll probably go into what the understanding of social protection is about. And if you have any questions, please feel free to put them down, and I'll address them after this particular presentation. So one of the definitions that we have worked with when it comes to social protection is that we define social protection as a set of transfers and services that help individuals and households to confront risk, adversity, especially during emergencies, just to ensure that somebody or people have a minimum standard of dignity and well-being throughout the life cycle. So that's one of the most common definitions that we have in terms of social protection. And as I said, poverty is a major global concern, and that both developed and developing countries are grappling with at this particular time. We are about 7.2 billion people on the planet, and close to half of those people are living in abject poverty. The hardest hit in this scenario is women, children, and older people, especially in the sub-Saharan Africa. So to me, when I think about poverty, I feel that it does stripe human beings of dignity, and it remains the most comprehensive assault we have on human rights. Now, UNICEF does a lot of work when it comes to supporting children and education, and they have their own set of definition, which is on looking at public and private policies and programs that are aimed to reduce poverty and economic social vulnerabilities, as well as deprivation. Another agency that has been quite common is the UK Aid, popularly known as DFID. And DFID looks at a subset of public actions that help address risk, vulnerability, and chronic poverty. So what DFID mentions here is that in terms of social insurance, this refers to the pooling of contributions by individuals, state, or private organizations, so that if they suffer a shock or in circumstances that beyond their reach, they are able to receive financial support. So some of you may already be having social insurance, especially as fellows here. We got medical cover and we got protection in terms of if we fall sick, there's coverage. There's also the other aspect of social protection that the UK Aid definition looks at, and that is social assistance. This comprises non-contributory transfers that are usually given to those who are deemed vulnerable by the society, and this is based on the vulnerability or poverty. And finally, the setting and enforcing of minimum standards within the workplace. So with those definitions, as you can see, different agencies usually have their own set of definition. In Kenya, where I worked for 2 years on social protection, we had quite a very long and lengthy social protection definition. It took me ages to probably put it in my head, and I would say that to date I cannot say it offhand, but I do understand that it is quite a comprehensive policy that tries to look at the complexities of poverty, and it looks at all the legal, legislative measures that could be put in place to ensure that everybody has the opportunity to have a dignified life. So it looks into livelihood as well as welfare to enable income earners and their dependents maintain a reasonable level of income. And then also another thing that our definition in Kenya on social protection ensures that there is access to affordable health care, social security, and social assistance. Some of these social security and social assistance come with conditions. Social security is more contributory, while social assistance is non-contributory. There are several approaches to social protection. We look at mainly 4 approaches, and one of them is the protective measures that social protection puts in place. Most of these aim to provide immediate relief from deprivation of basic needs, and these include things like pension, cash transfers. Some of you may have heard about cash transfers, food subsidies or food for work, different kinds of programs that come in to be able to provide for immediate relief when something happens. We also have preventive measures, and this approach really looks at the measures, the strategies that are put in place to prevent deprivation that may result as a shock, especially if you fall sick, if you lose your job. There are things like health insurance schemes. There are things that you put in place to save for the future or for some of these unforeseeable things. A lot of the preventive measures are usually very contributory. So very few people are able to afford healthcare services, medical covers, insurances, and things like that. Then we also have transformative measures. The transformative measures are those that aim to address social equity and also promote social cohesion. These are things to do with reforms of services and institutions providing the social protection services, the kind of policies that are being put in place to transform and change situations. And finally, the 4th approach to social protection is the promotive measures. So when we look at the promotive measures, these are measures that seek to boost real income and build capacity of people, e.g. microfinance, etc. And moving on to the next aspect of social protection, there are several multidimensional impacts that social protection offers, and you'll probably be able to see from the screen the different angles of impact that social protection does bring forward. So the first dimensional impact that I would like to discuss today is on poverty reduction. This is one of the main purposes of social protection, and it is to reduce income poverty, enabling households to use the markets to meet their most basic needs. So poverty reduction is in terms of social protection, looking at who are the most vulnerable in society and how do we provide to reduce them, to take them away from the level of poverty where they are. So if you're living below poverty and you're having to live on less than $2 a day, the social protection measures that come into place are to look to providing you with mechanisms to lift you up above the poverty level of living on $2 per day. One of the most popular indicators here is that policymakers look at head counts of households. So how many households have been reached with social protection services? So in terms of the poverty rate, different countries have different poverty lines, and developed countries probably have a higher poverty level compared to the, I would say probably to the developing countries. So if we look at the human capital is the most documented secondary aim. And I'll probably move to the next slide just to be able to show you some of the things that human capital contributes. It improves on the nutrition, education, and health outcomes. A lot of social protection services are either conditional or unconditional programs. What I mean by conditional or unconditional programs is that there are programs that are put in place that comes with conditions that must be met by the beneficiaries in order to receive their services. So for example, if you receive a cash transfer, one of the things that would be required of you as a beneficiary is to ensure that your children have to attend school. So regular attendance of school. There's also the other option of regular health checkups. Are the children healthy? Are they getting enough nutrition? Is it making a difference in their life? So those are some of the conditions that programs put in place for vulnerable households. Unconditional programs are those that definitely do not require you to meet some obligations in order to receive the services. Now, when it comes to human capital development, it has been seen as one of the impact that brings in or supports pro-poor growth, in that when you receive social protection, you're able to use the assistance, whether it be in cash or in kind, to improve yourself and build up capital for your household. You're able to increase labor productivity. So for example, one of the things that labor productivity contributes is that if I am an old woman, probably 80 years old, and I receive social cash transfer of 2,000 Kenya shillings, which would be about $25, I may not have the energy to go out there and dig my shamba or garden, but I can employ young people to come into my garden and probably dig for me, plant crops, harvest them, and I'm able to sell the produce that comes from that. So in terms of labor productivity, it helps you start up small businesses, and this has been seen as one of the best ways to support pro-poor growth. Social protection, when it comes to livelihood, this has been one of the surprising impacts. A lot of people who benefit from it are able to use, as I've just explained, the resources they receive through the social protection services to provide for labor and also participate in their market. In that, if you're able to have a higher purchasing power through the cash transfers, you're contributing. It may not be a direct impact, but you're contributing in a small way to the economy within your community. So there are small, significant improvements that have been documented in terms of this. The next thing that social protection looks at is the risk management. It is a very subtle but very powerful impact. Social protection, it definitely promotes better risk management and also encourages investment. Most of the social protection programs that we have seen succeeding have had people who did not have alternatives now running small businesses, growing and graduating out of those vulnerability category that they were initially put in place. When it comes to economic resilience, you can remember the picture that I showed at the beginning of the presentation, is that if you're falling hard on your face without something to cushion you, it is hard to bounce back. And if you cannot bounce back, you become a dependent, you depend on either your family or the state to take care of you, and this does not really do the economy well. But if, for example, right now the whole world, we are facing economic shocks, there's the economic crisis going all over. If you have a small income or a regular income that comes to help you, during those shocks, you're able to withstand them. You're able to bounce back. You're able to move on. And this also stabilizes the economy. So it is more like an economic stimulus, and helps everybody. So based on the multidimensional impact that I've just talked about, here is a summary of what social protection does, which is effectively reduce poverty. It also generates a wide range of development impacts. Another thing that we can say social protection has contributed to is the pro-poor and inclusive economic growth. This definitely, if you look at some of the reports that are put there in terms of social protection, you'll be able to see how it improves the livelihood. Now, with that said, there are broad challenges that we face when it comes to social protection. The first one is policy priority. I don't know how many of you have social protection policies put in place in your countries, but policy priority is one of the major challenges that really harbors social protection doing or being an effective poverty reduction measures. Without goodwill of our governments and country states, it is going to be very hard to look into affordability and technical, into the political goodwill. What I mean to say is that policy to be put in place in any country, there must be political goodwill. So this has to be a priority of the government in place to be able to succeed. There's also been a debate on affordability. The debate has been that social protection cannot be afforded by poor countries. Results have actually shown that with 0.2% of the GDP of any poor country, you can be able to provide social protection to the most vulnerable and lift them up from poverty. There's also technical design, which becomes a major challenge when it comes to designing the programs that are used out there. This has been a major challenge, especially in terms of capacity of those who are implementing the programs, in terms of targeting who do you choose, especially when you have half of the population living below poverty. Who do you choose to get the services? Who do you not choose? In terms of scalability, how easy is it to scale those big projects that need to reach as many people as possible? So these are some of the challenges that really need to be taken into account. And so with this, I take the opportunity to ask you to look into your own policies and as well as some of the measures that have been put in place. So I welcome you today to ask any questions that you have. There are a lot of challenges in terms of definition. We have so many definitions, as I mentioned to you, that I just listed a few. Many people do not know that social protection is a human right. Actually, the Declaration of Human Rights, Universal Declaration of Human Rights, Article 25 states that this is a human right and everybody should be able to get it. So it is not a handout. With that, I say thank you and welcome any questions that you have.
Yeah, I just want to quickly jump in and reiterate that to post your questions, just look at the bottom right side or the top right side of the Hangout page, and you'll see the Q&A button. Just post your questions there, and Trish will come to them as you post your questions. Thanks.
Thank you, Eunice. I'm not seeing any questions on my chart, so I don't know if I missed any while I was trying to wind up. I think this is the time now to...
Trish, if you look to the left hand tab, you'll see a Q&A button. Just click on that and you can see the questions there. I think there's a question by Trina. I'll just repeat it for you. She's asking, is this model suited globally or in the US context?
Oh, yes. Trina, thank you so much for this question. Social protection is a global strategy for reduction of poverty, and the International Labour Organization, ILO, is mandated to ensure that countries or states that are UN members set up national laws to ensure minimum guarantees of standards put in place for each and every country. So this model is a global strategy, and it has been used in many countries. I don't know if you've heard about Bolsa Familia. Is a social protection program in Brazil that has received international recognition for bringing reducing poverty in Brazil to currently, I think it's about 21%. I would have to probably check the actual percentage, but the Bolsa Familia program used predictable social cash transfers. This was conditional, and they gave vulnerable households support. In return, each household was expected to ensure that their children went to school regularly. They were also expected to do health checks just to see how healthy the children were, the difference that the program was making to the households. So yes, it is definitely a global suited method. And the US has a social protection program, so does many countries that are UN members. Yes. Victoria, thank you very much for that question. Are there minimal requirements for social protection related to healthcare? When you say minimal requirements, I don't know if it is the kind of services you get if you're enrolled on social protection, but one of the guarantees is that if you're on social protection, depending on which group and which package your country has put in place, you should be able to receive minimum health care. That is, if you go to hospital, you should be able to see a doctor, get diagnosis for for the illness you're getting. Things like I would say for like children under 5, they ensure that you have free healthcare during that period of time. So children who are under 5, pregnant mothers who go to hospitals are also able to be provided with healthcare services. Like, you probably heard of programs where social protection provides pregnant mothers with nets, mosquito nets, so that they encourage you to go and give birth in the hospital, and you each receive a mosquito net. Your children are provided with healthcare services when they're below 5 years old. There are also some countries that provide healthcare vouchers for persons over 65 years of age. So yes, there's minimal healthcare services. Challenges come when you have to provide for expensive healthcare. For example, you have to buy expensive medicine or go for an operation. Then the health coverage package does not really provide that. A lot of people have been able to receive enough subsidized health problems and healthcare services and things like that. So I hope that answers your question. Let's see if there's any other question. Does SP only apply for citizens or for foreigners in a country? Social protection, one of the things that happens is that each country is mandated to provide social protection for its citizens. As a citizen of any country, you automatically are in a social contract with your country to protect you within that territory. So there have been debates about providing social protection for refugees who happen to be in a country, or other people who come in and are vulnerable. However, because of the limited budget that most countries have, social protection has been mostly targeting the most vulnerable within the community, and in this case, those who are citizens.
Okay, Trish, I would like to wind up the webinar at this point because I think we've crossed our time limit. So let's just wrap up. And if you have any more questions, I invite you to email Trish directly. And thank you so much, Trish, for taking out the time to share this very interesting topic with us and opening this up for discussion. And I hope that the fellows who joined in live and the ones who will be watching the recorded version will be very interested in learning more about this subject. With that, I'm going to wrap up this this webinar, and we'll move on to the next one, which will be going live in the next 1 or 2 minutes as soon as we get the tech run set up. So I'm very excited about it. So see you guys there. Thank you.
Thank you.